spongy bone tissue. It is a little different than compact bone tissue. It is in the regular lattice, so like a sponge, all like that, of thin columns, almost like fingers, like that, and out of lamellae, and these units consisting of the osteocytes in them are called tuberculae. And where is it? It is in the outer rim around the medullary cavity of the long diaphysis of long bones. So if that is the humerus bone in the leg, that is long thing in the middle is the diaphysis, and the center of such a bone is the medullary cavity, and around it is the compact bone, and then around the cavity in the center of the medullary cavity, there is spongy bone. Or also in the epiphysis, so these things to the sides, the epiphysis of bones, the beginning and end, there is it also. Or in irregular shaped bones, there's also spongy bone tissue. And in between the spaces of these irregular shaped lattice, there is the red bone marrow in some bones, for example, the hip bones and the rib cage and the bones in the back. And these places, because that is the place where the red bone marrow is the place where the hemopiesis is happening. So where the red blood cells, the white blood cells, and the blood cells are formed. And where the osteocytes in such a tuberculae, these osteocytes are inside of lacunae, radiating from them are the canaliculi. And it is lighter, spongy bone tissue is lighter than compact bone. And these tuberculae, they are organized along the sides of stress, and the spongy bone tissue tends to be there where stress is coming from many directions. And that is according to Gerard Torgan Senegabowski's Principles of Anatomy and Physiology book on the page 164, 163, and 165. But this is no substitute for medical knowledge and also no medical advice, and the positions and views expressed are the ones of a source not necessarily aligned with my own or the ones of the entities spoken of. Hi and welcome. I'm trying to learn osteology, today spongy bone tissue, and after we've done what we're gonna do arm strength training. And if you participate in the arm strength training, then it's better the arm muscle. And we read it already 5-6 times, and this is no medical advice. So what did we have? We had here in spongy bone tissue these places in which the units in which the osteocytes are called tuberculae. And that is lamellae that are arranged in irregular lattice of thin columns of bone. Okay, that is actually the bone. They mean actually that. That is the irregular, this is regular, and that is the lattice, and it is thin bone. And that whole thing is like a sponge, so all these little things here, like irregular lattice of lamellae is what called. Thin columns, irregular lattice of thin columns, irregular lattice, thin columns are this is called out of lamellae. Okay. And in between all these spaces, between the lattice, there is red bone marrow. And that is producing red blood cells, white blood cells, and the red bone marrow, one of two types of bone marrow, consists of developing cells within a network of articular fibers. The red bone marrow produces red blood cells, white blood cells, and blood cells. And there's then this osteocyte lying in lacunae, from which also the canaliculi are reaching onto the sides. And they're getting the nourishment directly because, okay, we're not going to say that. And what is with the other one which are not lying at the medullary cavity? Directly from the blood vessels in the medullary cavity on the inside of the bone. And that is one place, and the places where it could be is the rim around the medullary cavity, and the epiphyses of the bones, and also in other short, flattened, irregular shaped bones. And these tuberculae, these units in them, with the osteocytes in them, are organized along the, organized along the lines of stress, which helps the bone to resist stresses and transfer force so that it's not breaking. And it is places where bones are not stressed and where stress is applied from many directions. It is lighter than compact bone. It consists of interstitial lamellae. Is there also calcification happening in the spongy bone? We never mentioned it. Would be interesting or not. Okay, it is lighter than compact bone, which is the main part along the diaphyses of bones, making the bone to move easier. It's lighter. It is also supporting and protecting the red bone marrow. It is in the hip bones, the rib cage, rib and breastbone, back bones. What bones are the back bones? Do I mean the spine? In the whole back are no other bones in the spine, or the ribs, the spine. The end of long bones, yes. And that is the place where... No. The spongy bone could be in other places. That is the places where spongy bone and red bone marrow is, and we know that it is the only place of the red bone marrow. And that would be hip, the rib cage, and the back bones, as well as the epiphyses of bones. And we have a hemopiesis happening with producing the red blood, the red bone marrow, producing the red blood cells, white blood cells, and platelets. Okay, I think we have it together. Let's look how far we come. We have 2-3 times. We have time for 2-3 takes. Spongy bone tissue. It is a little different than compact bone tissue. It is in the regular lattice, so like a sponge, all like that, of thin columns, almost like fingers, not like that, and out of lamellae, and these units consisting of the osteocytes in them are called tuberculae. And where is it? It is in the outer rim around the medullary cavity of the long diaphyses of long bones. So if that is the humerus bone in the leg, that is the long thing in the middle is the diaphyses, and the center of such a bone is the medullary cavity, and around it is the compact bone, and then around the cavity in the center of the medullary cavity, there is spongy bone. Or also in the epiphyses, so these things to the sides, the epiphyses of bones, the beginning and end, there is it also. Or in irregular shaped bones, there's also spongy bone tissue. And in between the spaces of these irregular shaped lattice, there is the red bone marrow. In some bones, for example, the hip bones and the rib cage and the bones in the back. And these places, because that is the place where the red bone marrow is the place where the hemopiesis is happening. So where the red blood cells, the white blood cells, and the platelets are formed. And there are the osteocytes in such a tuberculae. These osteocytes are inside of lacunae. Radiating from them are the canaliculi. And it is lighter. Spongy bone tissue is lighter than compact bone. And these tuberculae, they are organized along the sites of stress, and the spongy bone tissue tends to be there where stress is coming from many directions. And that is according to Gerard Toga and Senegabowski's Principles of Anatomy and Physiology book on the page 164, 163, and 165. But this is no substitute for medical knowledge and also no medical advice, and the positions and views expressed are the ones of a source and don't necessarily align with my own or the ones of the entities spoken of. I don't know, I could have added 1 or 2 things more, but I think it would have been maybe even better without adding these 1 or 2 things with a light weight. What I'm wondering is, it seems a bit as if his spongy bone tissue is not as stable as the other bone, but as we explain it, it seems to be even more firm than compact bone. That was the osteology part. If you're here for osteology, you can go directly to the next part of osteology. Then we'll continue with osteology. If you stay here and participate in the Armstrength training. Das wird ja anders. Good and stable stand. I wanted to say something else to respond. Armstrength training. If you participate in this, wird ja anders. And breathe in and release the fingertips to the side. Out and down. In and reach in front. High up, far back and down. Long arms or fists. Don't do it if it causes discomfort. Circle the fists and the arms around. The other direction. And now press with the fingertips together. If this causes pain or discomfort anywhere at the elbows, the wrists, the fingers, or in particular the joints of the fingers, then stop immediately. And also, you don't have to press with full force. The muscles of your arms are stronger as the joints of your fingers. And now with longer fingers. And next, press with the fingertips of one hand into the fingernails of the other hand. If this causes pain don't do it. If it causes damage at the skin or at the nails, then don't do it. The arm over crossing the body comes from the top, the other hand from the bottom, and give in. Other hand. Press and give in. Again, not with full force. Press and give in. Press. And two more. Press. Give in. Press. Give in. And now the hand over crossing the body comes from the bottom. Press. And give in. Press. Give in. Press. Give in. And the last one. One hand out and press, give in, other hand out and give in, hand out, press, give in, out. And now the square. Press with the hands together, not with full force, only if it does cause not discomfort. Go over, up, over. You don't have to extend the arms, don't extend actually the arms. And not with full force, and the other direction. Out to the side, up, not with full force, don't extend the arms fully, over to the side, down, middle to the side, up, over, down, other side over, up, middle, down. And the next the arms, but we're going to do 12 push-ups. You can do with the hands underneath the shoulders or wide push-ups, hands further apart and down. The first one. If you have the arms underneath the shoulders, put the elbows close to the second one. And the third one, and the fourth one. And number 5, tuck the tailbone in. 6, and 7, and 8, and 9, and 10, and the last 2, 11, and now, flex the arms again. Arms to the side, circle in the front and back. And one arm in front. Shoulders back and down, pull the arm in, have flat fingers. Try to relax the arm, go it back with the shoulder, turn the palm to the sky. The other arm. Shoulders back and down, pull the arm and have flat fingers, relax the arm, go it back with the shoulder, pull the arm, turn the palm to the sky, flat fingers. Anchor with moderate pressure over the middle part of the lower arm over the extensor digitoral muscle. Other side. And that was the Armstrength training. Thank you very much, and at the next time.